Eating and sleeping disorder. Lesson goal. Did you know that at least one person dies from an eating disorder every 52 minutes? Most of the people having sleeping disorders deal with eating order. So this module is going to focus on eating and sleeping disorders in detail. Learning outcome. Get an explanation on eating disorder with its types to differentiate the conditions. Describe sleeping disorder featuring the varieties to understand the issue. Have a review of how these sleeping and eating disorder are related to work on both problems. What is eating disorder? A person with an eating disorder is unable to control their attitudes toward food, weight, body size, or shape. It interferes with their life and causes them to change their eating and exercise habits and interrelationships. Dieting, fasting, overexercising, slimming pills, diuretics, laxatives, vomiting, or binge eating, consuming unusually large amounts of food accompanied by an overwhelming sense of loss of control, are some of the eating and exercise behaviors a person with an eating disorder may engage in. Weight and food aren't the only factors that contribute to eating disorders. They are also not about vanity or willpower. In eating disorders, a person experiences severe disturbances in eating and exercise behaviors due to distortions in thoughts and emotions, especially those relating to body image or self-worth. A person can suffer from an eating disorder regardless of age, gender, socioeconomic background, or cultural background. It is possible for a person with an eating disorder to be underweight, within a healthy weight range, or overweight. Types of eating disorders. Anorexia, bulimia, and binge eating disorders are the three types of eating disorders. Anorexia may be present in someone underweight and using extreme weight loss strategies. Bulimia may be diagnosed if the person binges and then powerfully loses weight. Anorexia implies being underweight by definition, but bulimia can involve being slightly underweight, in a healthy weight range, or overweight. If someone who regularly consumes large portions of food in a short amount of time, has a sense of losing control over their eating and does not compensate with extreme weight loss strategies, they may suffer from binge eating disorder. What is sleeping disorder? Sleep disorder is a condition that alters the way you sleep. Sleep disorders can negatively impact your quality of life, safety, and overall health. Lack of sleep can make you less safe behind the wheel and increase your chances of developing other health problems. Sleep disorders are characterized by excessive daytime sleepiness, irregular breathing, or increased movement during sleep. Sleep and wake cycles that are irregular, as well as difficulty falling asleep, are other signs and symptoms. Sleep disorders can take many different forms. It's common to categorize them based on how they affect you or why they happen. You can also categorize sleep disorders according to how you behave, how you sleep during the day, breathing difficulties, how sleepy you feel, and how you sleep at night. Types of sleeping disorders. Sleep disorders can be classified as follows. A person who suffers from insomnia has difficulty falling asleep or staying asleep at night. Sleep apnea refers to irregular breathing patterns during sleep. There are several types of sleep apnea. Sleep movement disorders such as restless leg syndrome, RLS. When you try to fall asleep, you feel an uncomfortable sensation and a strong urge to move your legs. Restless leg syndrome can also be called Willis-Ekbom disease. Narcolepsy, or sudden sleepiness during the day, is characterized by extreme sleepiness. How are these two related? Night eating syndrome, NES, has recently been described. It is a syndrome that occurs due to insomnia. Anorexic and bulimic patients do not exhibit specific electroencephalogram, EEG, sleep patterns. Only one study examined whether sleep EEG affected morphological changes in anorexics and normal weight bulimics. In patients with enlarged cerebrospinal fluid spaces, the duration of slow wave and rapid eye movement sleep was shorter. The ventricular brain ratio and rapid eye movement, REM, sleep time were negatively correlated in REM sleep. Binge eating, insomnia, and anorexia are the characteristics of night eating syndrome. As another criterion for evaluating the NES, the following criteria are proposed. Consuming more than 50% of the daily energy intake after the last evening meal. Awakening at least once every night. Repeating the provisional criteria for at least 3 months. Not meeting bulimia nervosa or binge eating disorder criteria. The patients do not suffer from amnesia or altered alertness, nor do they suffer from any other sleep disorder. Except for sleep maintenance, sleep EEG is not modified. NES is prevalent in 1.5% of the population. NES is associated with neuroendocrine disturbances. Eating disorders are not clearly distinguished from other disorders. When eating disorders, especially binge eating disorders, share compulsive characteristics with night eating syndrome, it may be considered a form of the eating disorder. When an individual awakens from sleep, they may binge eat compulsively. But in this case, night eating is linked with reduced consciousness and sleep disorders, mainly somnambulism. Patients never experience hunger, abdominal pain, nausea, or hypoglycemia. Weekends, holidays, and weekdays all involve night eating. Food and fluid intake was high, but there was no alcohol consumption or purging. Diurnal bulimia is often associated with sleep-related eating disorders. In conclusion, the sleep-related eating disorder seems to be a clinical subtype of sleep disorder, whereas the NES could be considered an eating disorder. So sleeping disorders are 100% related to eating disorders. Lesson synopsis. A person with an eating disorder is unable to control their attitudes toward food, weight, body size, or shape. Eating disorder interferes with their life and causes them to change their eating and exercise habits and interrelationships. Anorexia, bulimia, and binge eating disorders are the 3 types of eating disorders. Sleep disorder is a condition that alters the way you sleep. Narcolepsy, or sudden sleepiness during the day, is characterized by extreme sleepiness. Binge eating, insomnia, and anorexia are the characteristics of night eating syndrome. Food and fluid intake was high, but there was no alcohol consumption or purging.